Good afternoon, and thank you for joining us for another episode of We Are In This Together. It is the Red Cross program on staying safe and healthy during COVID-19. I'm Angela Hill. I host the program. And joining me today is Elena Viejo, and she is the Senior Officer of Protection, Gender Inclusion for the Red Cross for the whole Americas region. Hey, I'm so glad you're joining us today, Elena. Or Evelina, sorry.
No worries. It happens. No, thank you for having me here. It's a pleasure for being here and be able to share with participants at a different level and what's better that at distance and but also socially close.
Exactly. Thank you. So, can you speak to start with a little bit about what your role is? Like, what does it mean to do protection, gender, and inclusion?
That's a very good question because for some of our viewers and also for our national societies who are our representations in the regions of the Red Cross and the Red Crescent movement, it may sound new or maybe this is something they have heard but not clearly they have the information regarding what it is. So protection, gender, and inclusion is an area of focus with three key pillars, which seeks to address all the different inequalities that are heightened in the aftermath of an emergency, a crisis, or even in times of peace where we also have situations of protection. As I said, the area of focus has three pillars. The first is protection, which aims to keep people safe from harm. We understand that in communities there's different situations of violence, and we focused on the violence that happens in communities, but also at interpersonal level, in the houses, in schools, and even at the work level. So we aim to also address these situations of violence that are pre-existent, but also to make sure our services do not put in harm the people we are working with. The second pillar is, of course, gender, and it's the technical framework we have to direct our interventions. We recognize not all people are affected the same in terms of emergencies, and based on the difference people has in terms of gender, and that includes sexual orientation, gender identity, and gender expression, but also in terms of age, disability, ethnicity, and other situations of diversity, they could be affected by emergencies, crises, or community situation differently. And we as Red Cross have to respond accordingly with those differences. And the final, it's inclusion. And this is definitely one of the key mandates of the movement, and it happens in two ways in our interventions. The first one is to understand there are some key populations that are subjected to stigma and discrimination, and sometimes this situation of stigma and discrimination are related with social, cultural, and even political perceptions around a specific population. So that's the first one, how this stigma and discrimination affects different people and make them excluded of their rights. And the second one is how our services are as much accessible as we can. So to make sure we are not putting an institutional barrier, or even our teams do not have cultural barriers that can affect the implementation of our impartiality principle as humanitarians we are. So most of it, that's the area of focus. We aim to keep people safe, to make sure no one is behind and no one is left out.
That's wonderful. And when it comes to COVID-19, how do those principles come into play?
Well, that's definitely one of the main challenges that we had. There's different situations that we have seen with the protection, gender, and inclusion focal points in our countries. First of all, we have the collapse of health services due to the high demand, and that have created, for example, some key elements of health are not taken into consideration or not as much as they were. For example, sexual and reproductive health, hygiene, menstrual hygiene. Also, it's other situation. The access, for example, to mental health services is something that it's still having a lot of issues. The access to specialized health for people with disabilities or chronic illnesses. So that's one of the first issues. The second issue is most of the programs that were focused, for example, on migrants, who's one of the key situations that we are living in the region, have been affected in a differential way by COVID. So migrants, for example, are experiencing the lack of services of shelter, the situation of the high increasing of stigma and discrimination. And finally, other situation we are seeing is the arousal of domestic violence and gender-based violence, mostly focused because of the quarantine and isolation measures. So having in mind this very brief situational diagnosis, the I4C and the National Societies of the Red Cross have been focused on different topics. First, to make sure we have this kind of diagnosis in our countries. So we are doing rapid assessments of who's being most affected, who's facing stigma and discrimination, how to map out situations of violence. There's also another situation, the close-up of schools. Have created a specific protection risk for children and adolescents. For example, here in Colombia, as some of you may know, we had an armed conflict who's still active, and that has created a risk of child recruitment for illegal groups. So there's different situations we are aiming to always map out and assess. The second one of the protection lines, the Red Cross National Societies is providing, for example, psychosocial support through teleassistance. And this is one of the huge strengths of the movement, and all the mental health perspective they have. It could be from the side of just psychological first aid, or also just counseling via telephone. And also the third one is to provide focalized services for information. Definitely, now we have a pandemic, but also there's an infodemic. So to address this infodemic that sometimes have misinformation, myths, and creates situations of violence, have been one of the key elements of the response of the International Federation and the Red Cross National Societies, and not only information related with the very important measures of washing your hands, have good hygiene, but we also addressed that people need information, for example, where to report if I'm living domestic violence, where can I access education for my children if the school is in lockout, where can I access, for example, to support for livelihoods or cash-based interventions. So these complementary needs are something that we also have mapped out. In response to that, we have created a set of guidelines for the Red Cross National Societies to lead the response, because after all, they are the one who leads the implementation of actions in their own countries.
Yeah, that's great. I mean, and a lot of the things that you're talking about there are activities we're seeing within the Red Cross National Societies of the Caribbean. I mean, just off the top of my head, I know like Suriname and Trinidad and Tobago, Dominica, Antigua and Barbuda, and others, I'm not mentioning Jamaica, are all running PSS hotlines like you're talking about, at the very least, as well as other things. So it's really interesting to hear how, I think people think of that as, well, we're providing as like a psychological support or like a mental health piece, but how it also crosses over to touch on protection and gender and inclusion. So it's really interesting how that comes up.
Definitely. It is very interesting, however, how they have created targeted messages for elderly, how they have created messages for children and adolescents. we've been working with a PGI delegate in Bahamas, where they are providing meals on wheels, but they have trained the drivers on child protection and inclusion. So definitely, as you can see, PGI could be, protection and inclusion can be a transsectoral approach, but also a focalized approach, and that's one of the most interesting things.
That's so good. I know too, when we're talking about protection and gender, like for me, sometimes what I think about is I think about like violence and stopping violence against women or gender-based violence. And I know we've heard reports of sort of gender-based violence because of movement restrictions around COVID-19. Can you speak to that?
Yeah, definitely. This is something we have seen, and that's one of our main concerns. Um, Definitely, since the collapse of the health services and also the very understandable measures of isolation and quarantine, this has created different factors. For example, the first factor is the process or the services related with gender-based violence are not the same or are closing. The second one is that gender-based violence could be now heightened because of the stress families are living in their houses, and also for families who were already living violence in their houses. Definitely, the affectation of livelihoods and the economic sustainability has been one of the key issues that have been enhancing different situations of violence. But it's important also to understand the gender-based violence is not always in closed centers, in closed situations. We have seen there's different manifestation, for example, of trafficking, who's increasing directed to migrants who aim to cross borders and trying to move to a safe place. Uh, and unfortunately, this is affecting more women and girls, since trafficking by means of sexual exploitation is one of the most prone risks they are facing. There's also an alert that we are working with UNICEF and in the decreasing of sexual abuse directed to children in their houses. And it's unfortunate how care and very responsible measures such as quarantine and isolation have increased these protection issues.
And so what can people do to stay safe? Like, what can we tell people?
That's very interesting. Maybe I will select two situations. The first one is where you are identifying you are have some manifestation in your house around gender-based violence and domestic violence, and the other one is and never happened before, and the second one is when you already were living this situation, and because of quarantine maybe you are living with your aggressor. So in the first situation where no, this never happened to you, and this was something that you never faced in your home or in your personal space, it is important to seek for situations of conflict resolution and even conflict transformation. That's why the Red Cross has opened these lines, and I'm sure most governments have offered support, telephone support for families who have a lot of stress and who have a lot of questions related with what's going on and what's next and where to receive resources. Because definitely stress, misinformation, and even lack of information and the lack of access to services is one of the factors who is enhancing the creation of situations of violence where never happened. So I think that definitely families who were never facing this kind of stress, it is important to identify, for example, what's creating stress, where to access the services, and for that reason, Red Cross is one of the key allies to provide this information. One of the main issues that have created domestic violence and gender-based violence against women and girls in houses has been, for example, the duplication of roles, of the perception that the responsibilities and the pressure has increased. Recently, CARE and even women did a rapid assessment on gender, and there was a perception of women that the pressure at home was increasing, especially where they work and also they have to care their children. So for these women who are with their partners and also have children, it is important to create plans to share responsibilities, to not just create a sense of responsibilities completely focused on one person, and also to create spaces for coexistence, for recreation, for sharing. One of the main issues is we are not informing children of what's going on. And there's a lack of information that is adapted to children of what's going on. And this is creating situations of domestic violence where children, for obvious reasons, they fear, they don't understand what's going on, and unfortunately their parents are not informing them about what's going on. So Red Cross has created these materials. So that will be in the first situation. In the second situation, when you were already facing violence, when unfortunately, for example, going out was a way of escaping or avoiding situation of violence, definitely, it's important to take into account the level of violence you are facing. Um, Most of the gender-based violence start with psychological violence, screaming, type of verbal abuse, neglect, ignoring, and this goes up. It never goes down. And also have some situations, as we call it, the honeymoon phase, where apparently everything goes well, but later explodes the situation of violence. So to be aware of these situations and also to link with a specific service lines to identify which is your service line of gender-based violence in your country and the services they have provided, it's key. However, we are facing that it's very hard for women who have living with gender-based violence to call and to report where you have your aggressor just by your side. So we're aiming for organizations to create different and more safe opportunities for women to report if they are passing a situation of violence. For example, panic buttons in applications of cell phones, or also there's initiatives here in Latin America where they can report in the supermarket with a word that is very specific. By no means apparently they are reporting, but actually they are reporting. And also there's a very interesting perspective of UN Women that to promote community co-responsibility. And is if you as a neighbor hear something, if you as a neighbor know and you are aware of something happening, this is not a private matter. Gender-based violence is a public matter, it's an structural issue that affects directly all the population and has a direct effect on the well-being of the population. So you have the right also to report and maybe to save the life of someone who's suffering and cannot report safely.
Thank you for those. I mean, when we talk about being safe and healthy and during COVID-19, I think a lot of people, and even me included sometimes, you think about just like, oh, well, I washed my hands, right? But there are all these other aspects that, you know, with movement restrictions for public health reasons that could have these other pieces to them. So I think it's really valuable you bring those forward and talking about how it is a public matter and how we all sort of work together on this. Is there anything else that you want to add or touch base on at this point?
I think it's very important to do not only a reactive action regarding gender-based violence and also domestic violence, but it is our responsibility to enhance preventing measures. For in our culture, we completely normalize situations of violence to communicate ourselves. Harassment is something that it's very criticized as not being violent because you are only hearing you are pretty in the streets or how lovely you are. But the violence is completely have significance and impact when I feel threatened. and there's a consequence directly to my safe and my perception of safety. So it's not. We have to work harder on how to sensitize communities on what's violence and where to access. For example, as I said, in gender-based violence, the reason why survivors takes too long to report is not because they don't want to, or it's not because they love their aggressors, and we can talk more about that in a minute. It's because they do not identify they are passing a situation of violence. Because still we have values that merge into our cultural landscape and validate a lot of situations of violence. Even, for example, we're still validating physical punishment for children and being in 21st century. So this is something like the preventing measures are something we have to focus on, and now more than ever that is increasing in COVID.
You mentioned about whether people love their aggressors or not, that you would just mention further on that. Sort of, can you speak to that?
Sorry, Angela, I lost you. I am not hearing very well. Can you repeat?
You mentioned when you were talking at the beginning that it's not about them not loving their aggressors, and you would sort of speak to that more in a second. Is there more to that? Like, what can you say on that?
I didn't get that. Sorry. No, it's hearing very cut.
No, I'm sorry, you're cutting out. No, just around, you said whether people are loving their aggressor, like the person who's causing this. You said that it's not that case. Can you speak more to that? Oh, I think I'm losing you.
No, sorry, it's not entering. I don't know if
no, it's okay. I just think it's a bit of a bad connection. Well? I think maybe we'll wrap it up there then, just because I think you're having a little trouble with your internet because your picture keeps cutting in and out. But thank you so much for the valuable information you've given. I know there's more information about gender-based violence on the website, Red Cross website, so you can access that there. Many countries do have those numbers to call for psychosocial support. And those kinds of tools are there. So see what's available in your community, see what the Red Cross has as part of the services they're offering in your communities, and continue to take care of yourself, not just when we talk about health and safety for COVID with things like washing hands and the like, but in those bigger picture things. Look out for yourself, your friends, your families, your neighbors, your communities, and that's how we will stay safe and healthy during COVID-19. Thank you so much for joining us, Evelyn. I'm not sure if you can hear me or not, but thank you so much. And to those of you who are watching, please, if you have questions or you want more information, don't hesitate to leave a comment or respond to us, and we will do our best to answer all the questions. Thank you.